Thank you so much. All right. So I think, Anu, 3 minutes past. I think.
Yeah, let's start. Yeah.
We can start. Yeah. Thank you.
So I see everyone here. Before we start, I just want to let everyone know that if you can keep your audio on mute, if you can just keep an eye on that, it'll be helpful while the workshop goes on. And if you can turn the video on, which is, we would love to see everyone. And also, if there is any question or anything like in terms of audio, video issues or anything, if you can please use the chat box. That way it doesn't disturb our session. And so we will be, this is the Healing World workshop organized, presented by the Shakti Multiversity, and with Dr. Zubin Marolia, the homeopath and integrative medicine, and his profile doesn't go by 2 lines. An amazing person whom I've met a few months ago, and it's just very compassionate, very amazing person. And it's an honor to have him here. And thank you so much, Zubin, for being with us and taking this for everyone. And so our program today will be like this. I will be here anytime you have any question, any issue. So use the chat box. We will start with Guru Vandana, respecting, connecting to the divine. And after that, we'll have keynote by Acharya Agyaatadarshan Anand Nath, and followed by Hamare Zubin ji, and a workshop, and then he will take it forward from there. Any questions, anything. And the only request, please respect the room. And if you have to leave for any reason, use the chat box. I would really appreciate that. And we'll start with Guru Vandana. And Venkateshi, if you can do the Guru Vandana, please.
Shiva. Om Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Brahmanandam Paramasukhadam, Kevalam Jnanamurtim, Dvandvatitam Gaganasadrusham, Tattvamasyadiraksham. Ekam nityam vimalamachalam, sarvadhi sakshibhutam, bhavatitam trigunarahitam, sadgurum tam namami. Shvetam shvetavirepamalyavasanam, vamena raktotparam, vibhratya priyayetareena tarasa, shlishtaprasannanam. हस्ताभ्यामभयं वरं च दधतं शम्भुस्वरूपं परम् आलाघूर्णितलोचनोत्पलयुगं ध्याये शिरस्थं गुरुं ध्याये शिरस्थं गुरुं ध्याये शिरस्थं गुरुं.
Thank you, Venkateshi. We have Master, founder of Shakti Multiversity, Acharya Agyaatadarshan Anand Nath here. Thank you, Acharya ji, for being with us here today. And if you can tell a few lines about the program.
Anu, I think Dr. Zubin Marolia needs some introduction to those people who don't know his credentials. So before I speak, I would like to, just talk about him. And then, see, I am inconsequential here. this workshop is of Dr. Marolia. Uh, I mean, you must introduce him properly to everyone so that everyone not only appreciates but also honors the opinion he is putting here.
Yes, Acharya. Dr. Zubin Marolia. To start with, I have to say that he's an amazing human being I met, and that's like it feels like he's talking to everyone, like come from within. And as I met him a few months ago, and we were talking about homeopathy, and that's where our interaction started. So to tell you all about him, he is, if we start looking at ourselves and we want someone to say, hey, what's your story? Someone to listen, someone to be with you. It's Dr. Zubin Marolia, who listens through the journey of everyone, every person he meets. And he is a qualified, renowned homeopathic physician. And because of his compassionate, empathic nature, he is one with us. He talks to us. His qualifications of homeopathy takes us to tell us our story. His way of what should I say? Interaction and his questions, the way he questions, the way his interaction is with. I think that's the most a doctor can do. And I have his profile in front of me for everyone who wants to know him as a doctor. He is a renowned homeopathic physician, and he has, because of his nature, empathetic nature, he has become a doctor who has understood one of the biggest challenges of the humanity today, cancer. So he has graduated from Bombay University, and he has researched and dedicated his life into the field of oncology. And he believes that these little homeopathic tiny pellets can heal a patient holistically. And there can never be a healing system so safe, gentle, and effective in treating illnesses and restoring the vitality of the patient while curing them, is what he believes in. That's the homeopathy. And he was invited as a clinical observer at Memorial Sloan Kettering Cancer Center in New York to deliver a lecture and also to deliver a lecture at the Johns Hopkins University School of Medicine in the USA. He worked with the clinic Ursuline in Switzerland and many other institutions, universities in various countries like Germany and the University of Vienna. He has a distinction of delivering 4 consecutive presentations at the Integrated Medicine meeting in Germany. And he was also a speaker at the Truth About Cancer event in USA, a global project that documented alternative approaches to treat cancer. And that reached about 50,000 people in the world. Once you spend time with this healer, I think that's how he's fondly called or referred in India. You'll notice a fascinating trait of Zubin. And his first question he asks, or the first connection we make with him, is when he says, "When were you last well?" And he cares for everyone, and that's why he's here with all of us to spread what he thinks is needed today to everyone. And now, yeah, Zubin, if you want to say a few words, I would really appreciate that.
All right. So, namaste to everybody in this program today. And my journey as a doctor in India, as a physician in India, began in the year 1991 when I graduated from the Mumbai University and took my first steps in the medical field as a doctor. And after a few months, when I was seeing patients at a very, very early point in my career, I wanted to work in a field which was equally challenging, and that was cancer. And that is when I was invited to participate in a healing program and learning program on mistletoe therapy of cancer in Arlesheim in Switzerland. And my main practice, my primary practice in Mumbai and all over the world today is homeopathy. And we practice homeopathy according to the classical principles, trying to identify the root cause of a disease, of an ailment, and trying to understand all the symptoms of a disease. And then I proceeded my journey in life. This was in 91. In 1994, I went back to the Lucas Clinic in Switzerland to gain more training on the mistletoe plant and its use in cancer treatment. And for everyone over here to throw some light on the mistletoe plant, it's basically like the Tulsi plant in India. It's a very, very holy plant that grows in the European continent. And I began my research on applying the mistletoe plant therapy for our cancer patients in India. And at that time, I'm very proud to say today that I brought back this knowledge gained by working with European doctors at a very, very early point in my career. And all this knowledge and experience, I came back to India and I've used it for our Indian countrymen. And then I was married and I have two children. And then I began my practice seeing more and more patients, healing them with homeopathy, not only cancer patients, but common patients as well, with a common cold, a migraine, a sore throat, asthma, diarrhea, etc. And in 2009, I was invited to share my experiences in Memorial Sloan Kettering Cancer Center in New York. I was there. And then in 2013, I delivered a lecture at Johns Hopkins University School of Medicine. And I visit the United States every year and take part. And I speak at a conference in Florida, in West Palm Beach, called the Annie Appleseed Conference. So that's a little bit about my journey, my dear friends. And we start the program today. Thank you, Anu, for the kind words of introduction. And a warm, warm welcome to all. As medicine and diseases have evolved in the last 30 years in India and all over the world, and as we all know, we had the pandemic about 5 years ago, and we were struggling with the pandemic, trying to come to terms with how to enhance our immunity, how to enhance our resistance mechanism and our defensive mechanisms in our body to fight a disease. And much of my life has passed trying to understand the entire life journey of a patient and how to enhance the defensive forces of the patient so that the patient can combat any infection, whether it's bacterial, viral, fungal, etc., and also tackle common allergies. And I take you back 100 years, my dear friends, to a very, very small quote and a very, very meaningful quote in the medical world. And this quote is by a physician called Sir William Osler. And the quote says that it is more important to know what kind of a person has the disease than what kind of a disease is there in a person. And the current Western medicine application and practice basically deals with diseases and the diagnosis of diseases with a checklist of symptoms, wherein the patients approach their doctor and they have spent a small time with the doctor trying to know the symptoms, and then the diagnosis is given and certain blood tests are done, blood investigations are done, and the diagnosis is given and the treatment is based on the diagnosis. But what is more important is the person who has the disease. That is very, very important. Right from the time the person wakes up in the morning, how does he wake up in the morning? Does he feel refreshed in the morning? Which is based on, does he get adequate sleep? Is his sleep refreshing? And then when he wakes up in the morning, does he start his day very, very fast? Does he have a proper breakfast? Does he go to work? How does he go to work? What is the distance between his home where he is living and the working atmosphere and the working place? And wherein he works for about 10, 12 hours, is the work fulfilling? When he leaves the office in the evening, does he feel satisfied and fulfilled by the work he is doing? And then when he comes home to his loving wife and loving husband, does he get the love, nourishment, and does he get adequate rest? And does he eat proper dinner and go back to sleep? That is the life journey of every human being. And the way I see medicine being practiced, wherein a small amount of time is given only to diagnose the disease, and not enough time is given to understand this life journey of a patient. And this is very, very important, because you have to understand how a patient lives their own life, their relationships, right from childhood, father, mother, adolescence, schooling, college, work experience, experiences at work, and then retirement. So when I see a patient in my clinic, whether it's any ailment, whether it's common cold or big cancer, it's always to understand the journey of a patient. And I'm known all over the world by my opening line, wherein I myself call the patient, walk to the waiting area of my clinic in Mumbai, and we call the patient to the clinic, and we sit and we start talking about their journey. And the line that I use is, tell me your story. Tell me your story. And I take you back a few years when I was seeing a patient in Mumbai, a patient with advanced ovarian cancer, who had come to me with her husband, and she was in stage 4 of cancer. And she comes up to me and she says that she wants to do mistletoe therapy, which is my specialized therapy in cancer treatment. And she shows me all the reports and the chemotherapy and the surgery and the radiation and all the other investigations done. And she has a hemoglobin of only 7 grams %. And her entire left leg is swollen like an elephant's leg. And she has stage 4 cancer disease. And I asked her, I said, tell me your story. In Hindi, as we say, apni kahani bataiye. And then she mentions about her entire life journey over 1.5 hours to 2 hours of sitting with the patient, offering a patient some tea, some water, to make the patient comfortable to unfold their life journey. And she mentions that she began very early in life, supporting her education, began working as a housemaid, experiencing financial struggles because of the financial difficulties the family faced. So she was educating herself, and she was also working at the time. So working from the tender age of 12 years and working, educating. Then she began a job, again, working very, very hard and facing financial struggles and other struggles in their life. And wherever you see in a cancer patient, there are certain thought patterns that come out very, very distinctly. And one of the thought patterns is this kind of struggle, whether it's financial, emotional, physical, etc. So the entire aspect of understanding her life journey, her entire financial struggles, physical struggles was understood, and she was given a homeopathic remedy and, of course, mistletoe therapy injections. And her hemoglobin improved. She felt better. And I asked her towards the end of the consultation, so what do you want? How do you want me to help you out? So she says, give me a medicine so that I can work, I can earn some money. That was what she said. And then we start the treatment, and her hemoglobin improves from 7 grams per cent to 9 grams per cent, 10 grams per cent. And she starts work in her bank where she was working earlier for half a day. And she gives me a call that, Dr. Marolia, I have begun work in my bank. I'm very, very happy. My quality of life has improved, what we call as a phenomena called salutogenesis. And slowly she begins working half a day, and then she works for the full day, and she lives a good quality of life, and her life journey improves. And this is exactly what I mean, that medicine is not just the art and science of medicine. It's basically to understand the entire life journey of a patient. And that's exactly what we are going to talk today. So this is one story, and I'm going to bring you many, many more stories of life journeys. So when I decided to have this talk today, I was thinking about what aspect in medical science we should discuss, and what aspect is so very important in the wellness and the illness journey of every patient. And that is the root cause analysis. And that is, what is the root cause of a disease? When you fall ill, there is a reason why you fall ill. There is a reason wherein your immune system, your defense mechanisms of the body go down, are depleted, and then you catch maybe a sore throat or a bad cold or a migraine. So when we undergo the life journey of a patient and we sit with a patient for 1 hour, 1.5 hours, maybe even 2 hours, we try to understand why the patient has fallen ill. And this brings us to one of the most beautiful questions in medical science today. And when I teach at the Medical University in Mumbai, Anu, Mr. Sandelia has been there with us, attending my OPD at the Medical University. Every Tuesday, I teach at the university wherein we have young medical students, young medical doctors, and I always discuss with them this beautiful question, which I firmly believe every physician, every doctor in the world should ask. It's not the checklist of symptoms. It's not tell me your symptoms or show me your reports or show me your scan or show me your blood test, show me your tumor markers. The question is, the physician should make an attempt to understand, when did the patient fall ill? What is the journey from wellness to illness? The question is, when were you last well? And this is a question that is often missed by physicians because they are busy evaluating the diagnosis and the checklist of symptoms. So very, very important. Much of the cases today that I've got, I was studying many of my cases of this year, and I bring you certain stories which I'm sure will throw some light on the work in the medical world. And thank you, Anu, for giving the opportunity for sharing my experiences to your organization. When were you last well? Such a beautiful question. And when the patient is asked the question, many a times the chronic illness has started so many months or years back, the patients have no clue as to how the illness has started. So they will think back, they will try and roll back the years, unfold their journey, and you have to give time to the patient. So I'll tell you a very, very small story of a patient that I saw recently of an elderly lady who met me at my clinics in Mumbai. I've got 2 clinics in Mumbai wherein we undergo these life journey sessions, one in Dadar and one in Andheri. And she comes up to me with a sleep problem. And she says, I'm not able to sleep for so many years. And I ask her, can you go back and tell me as to why aren't you able to sleep? So she says, I don't remember. I am taking these sleeping tablets. She starts with one sleeping tablet. Then there is a second sleeping tablet. And then she takes a certain tranquilizer, etc., some psychiatric drugs, etc. And then I ask her, I said, tell me about your family. Let's talk about your family. So her husband is there and she has one daughter. Daughter is 29 years old and she is married. And the lady lives in Mumbai. And I asked her, I said, where does your daughter live? So my daughter lives far, far away, about 25 kilometers from where I live. So I try and coax the patient to understand why they are falling ill. Much of the process in medical healing and in the healing world, as we are talking today, is by knowing the journey of the patient, you are coming to terms and making the patient come to terms with their illness. So they begin thinking about their own health, about their own illness. So it's an empowering process. When you take the history of the patient and know their journey, it's an empowering process of involving and actively participating of the patient in their healing. And then she says that when my daughter couldn't get married many, many years ago, I was extremely tense. And that is when the sleep problem started. Now here you find that she goes to a physician and he is busy prescribing sleeping tablets. So I ask her, what is your daughter's name? So we go inside into the journey. We ask, what is your daughter's name? And my daughter's name is this, and she's working, she's very, very busy. When I asked her, when was the last time that she had come to meet you? That was many, many months ago, she mentioned. Then I asked her, how do you feel? Again, a very, very important question in medical practice is, how do you feel? So she says, I miss her. So I tell her, fine. I said, ring up your daughter now. She says, you want me to call up my daughter right now in the consultation? I said, yes, please ring up your daughter. So she calls her daughter and I discussed with her daughter. I ask her her well-being, etc. And then I tell her that your mother is facing this particular problem and you need to be aware of the sleeping problem and you need to come and visit her often. Maybe take your mother out for a meal, take her to a mall, take her shopping, take her to see a movie, have dinner with her, and that will help her sleep problem. So here we are reaching out to our patients, reaching out way beyond what is required, reaching out to our patients, trying to understand the exact causative factor of the illness. And that is the main crux of our talk today of root cause analysis. So the daughter gives me a call the next day that she has connected with her mother and they are going out for the weekend. And I said, take her for a holiday. Take her for a holiday. And I asked the patient, I said, when did you last go on a holiday? A most important question in healing. Everyone needs a holiday because when you change the way where you live and you go on a holiday, it's a different area, it's a different part of the world. And then she takes her for a holiday. The patient receives a homeopathic remedy and she continues a consultation with an improvement in her sleep. So this is a very, very important part of understanding root cause analysis in patients. Now, when you say RCA, when you say root cause analysis in medicine, in medical practice, what do you mean? So what you mean actually is, why did the illness happen? What happened? And what will you do to prevent it from happening again? So you have to remember these three happened words. So whenever you go to a physician, my dear friends, he has to ask you, when were you last well? And this was my topic and my subject when I spoke at the Annie Appleseed conference in Florida last year, trying to tell patients in the United States and around the world of trying to understand that the person is more important than the disease. So when you say about root cause analysis, finding the root cause is why it happened, what happened, and what can you do to prevent it from happening again. And we take you to another story. And I'm sure that these stories will gel with you all today, because you will learn more from the stories. And whenever I go to the medical university, before we start the outpatient department every Tuesday, and I'm well known now all over the world, every Tuesday is the medical university teaching day. And we tell our students, I share these stories with my students, trying to understand what is happening in their lives. And this is the story of a cancer patient who has had a recurrence. She's a breast cancer patient who has had a lung recurrence, a pulmonary recurrence, a metastasis 2-3 times. And she comes to me for mistletoe therapy and for her cancer treatment. And we examine the patient. Patient is well preserved, normal weight, all the vital parameters are normal, and she has got 2-3 spots in the lungs where the cancer has spread from the breast. And it's a breast cancer patient. And we take the whole history of the patient, and then I ask the patient again, when were you last well? What exactly happened? And as we began the history of the patient, she already has been operated, and a lung surgery has been done on one side, and a huge surgery, robotic surgery, when she already had a cancer in one lung. So that part has been removed. Now she has a cancer in the other lung. And now they can't operate because you can't remove both the lungs. So she comes for mistletoe therapy and for integrative oncology treatment to me. And we have a 1.5 hour session. We ask her, I ask her, tell me about your life, about her children. Both children are well settled. They are in the United States. She's over here living with her husband in Mumbai. And then I give her some time. And this is again a very, very beautiful part of medical practice, wherein you give time to patients to let them unfold. And she says, Doc, I'm very afraid. I'm so afraid now that they're going to tell me to again operate and again be in the ICU and again spend so much time in the hospital. I want to be at home next to my husband, who is so elderly, and look after my husband. I don't want to go to a hospital, and I'm afraid. And I'm afraid. And I'm afraid. There's a deep-seated fear in her, which encompassed her whole being as she shared her life journey with me. And this particular part of the fear of the cancer and the fear of the cancer affecting her health was very, very deep. And then we plan out the entire treatment for her, and we reassure her, very important, we reassure her that, ma'am, you start mistletoe therapy, you start the homeopathic remedy, and there is a homeopathic remedy that we use in cancer patients when there is so much fear. It's called carcinosin. And the mistletoe therapy was started, and I reassure her that she need not be operated. The point over here is that her oncologist in a super specialty hospital didn't have the time due to whatever reasons. And she has been prescribed targeted therapies with a consultation of about 12 to 14 minutes. And then she unfolds her journey, and we try to understand the mind-body-spirit axis. And we understand her being. We understand the fear the patient is undergoing in their lives. And that is what is important. And she's feeling much better now. in the few months of therapy, few months of treatment. She continues her mistletoe therapy injections and her homeopathic medicine. And we reassure her each time, explaining to her each and every time she comes, trying to see how she is coping with the fear and coping with the disease and looking after her husband. So when you understand that life journey of a patient and the root cause analysis, you understand the exact point, what they are thinking in the mind and the entire mind, body, spirit axis. Why it happened, what happened, and how, what can you prevent from happening? And this is a very, very important part of treatment, of therapy in a patient. When I spoke at the Annie Appleseed conference in Florida, I'm going there for the last 3 years. And this time I spoke about the inside out journey, wherein I was doing my reference work, trying to prepare for my presentation. And in the last 2 years, I've always been presenting one slide. What is medical treatment? Medical treatment is exactly how a physician and a patient interact, what is their partnership, and it will always be, medical treatment will always be, however advanced the world will be, however algorithm the world will be, however sophisticated investigation that you do, my dear friends, medicine and medical practice will always be one patient with one physician, with one caregiver, in one room, with one story. And this is what we have to understand. And this is what the medical world has to understand, that you have to spend time with their patients to understand their journey and the root cause of the illness. Let's go to a different part of feeling well. As I mentioned, many times when I have a patient in my clinic, we do a follow-up and I always ask, how do you feel? Am I right? How do you feel? Actually, have you ever thought of how do you feel? Because it's so very important. How do you feel in the morning? How do you feel in the afternoon when you are at work? How do you feel in the evening? I had a lady passing through her menopause yesterday in the clinic, and she says, I'm completely fagged out and fatigued in the evening. And she comes with all her blood reports and a blood tests, and she's done a chest x-ray, and I say, okay, I'll have a look at the reports, that's fine. But she doesn't have a timely lunch. She has a very hurried breakfast in the morning. She hardly drinks water, and she has acute stress levels trying to cope with so much of work, and she works for 11, 12 hours a day. So she's bound to be fatigued. It's so very simple. But I fail to understand why her MD physician, why her internal medicine physician didn't spend time to ask what she does. And she travels from one part of Mumbai to another part of Mumbai, a journey of 1 hour and 30 minutes, rushing to office, working so hard, she's bound to be fatigued. So then I had to explain to her that this is the root cause. The root cause of a fatigue is a bad lifestyle. And she's holding a very, very eminent position in an IT company. An educated person, an educated lady. And then I said, look, when you wake up in the morning, do not rush into the day. Take your time in the morning as you wake up. Take your time. Let your body's hormones and systems come in shape to face the day. Have your proper breakfast. Travel, have your proper lunch. When you have your lunch, it should not be a power lunch or an e-lunch. It should be a relaxed lunch. It should be a lunch wherein you don't use a device. Many times I have patients who say, no, it's an e-lunch or it's a power lunch. And I fail to understand. Because when you are doing that, when you are having lunch with the device on, the blood is being supplied to your brain and it hardly goes to the liver and the intestines. So where is the digestion? And then you land up with a gas problem and a flatulence problem, and then you meet a gastroenterologist, and then you do an endoscopy, and then the whole story starts. But how do you eat your food? Has anybody asked you? So very important. And then she's so tired, she hardly has a dinner. So I tell her that this is the way that you have to modify your lifestyle. The root causes were identified. What happened was identified. Then I explained to her that this should not be happened again. Many a times, the smallest thing, the simplest things are missed. And we see patients with weight issues today all over the world. Am I right? We see obesity, we see so much of weight issues, and there are new drugs. And I open the newspaper in the morning and I see Ozempic, I see Mounjaro, I see so many new remedies coming up in the market, in the pharmaceutical market of trying to understand weight issues. And it's so very important. What is a weight issue? It's a weight issue wherein food is the main factor. How do you eat your food? And many a times when I see patients with chronic GI disorders, with acidity, flatulence, gas problems, they go to a gastroenterologist, have an endoscopy done. My first question to them, is, how do you eat your food? Do you eat your food very fast? And do you eat your food with the device on? Do you eat your food on time? Many a times, women, mainly housewives in India, because they are so busy serving food to their family, they neglect their own part of having their food, even in an Indian society, in a conservative Indian society. So how do you eat your food is so very important. That's when you get digestion. And if the food is digested properly, you don't form gas and your weight remains stable. And did you exercise? Many times we find patients with chronic fatigue who come to me and tell me that they are on these supplements. And as I mentioned in the program, in the brochure, if you read very carefully, I mentioned a line wherein I've said, people go on an internet supplement finding spree. They go on the internet, find out some supplement, calcium and vitamins, and so many people take so many tonics. My goodness, if I were to tell you the list of supplement my patients take from my case records, it will take me 2 to 3 hours to list the supplements. You don't need a supplement at any point of your life, provided you live a balanced lifestyle, provided you are eating normally, provided you are relaxed, you have a balanced lifestyle. Provided you sleep on time, you sleep well. And provided you take sunlight. Now, today we all live in tall buildings, including myself. How many people actually take sunlight? So whenever I have a patient with chronic arthritis, bone problems, neck problems, cervical spondylitis, lumbar pains, my first question is, do you take adequate sunlight? धूप लेते हो कि नहीं? Even if the sunlight is on weekends, I agree that people are busy in the morning. Women, housewives cannot take sunlight, but you have to make it a point. And then they go on calcium, and this supplement and vitamin D supplements. That is not healing. You need a supplement if you are deficient. If there is a proper deficiency, then yes, you need a supplement. But even that also can be compensated by food. I'll give you an example. Many times we are seeing a lot of eye problems nowadays in the world today, right? A lot of dryness of the eyes, a very common symptom. In fact, a very, very common symptom nowadays is dryness of the eyes. And people are putting refresh eye drops and this eye drops and that eye drops. Then there's a gel, etc. They go to the eye doctor. So you have to understand that dryness in the eyes can be cured and can be complemented and can be controlled by having a very rich diet in carrots and beets. If you have carrot and beetroot raw every day, many of my patients, including myself, I used to have dry eyes because of computer usages, mobile phones, etc. You are fine. So again, you are going back to a deficiency, but trying to find out the cause of the ailment. That is why we are facing so many chronic problems today. And that is why a physician, time and again, and I teach this at the medical university, and I tell my students, my interns, that you sit down, sit with a patient, talk with a patient, see what is the exact ailment, what is the origin of the ailment. And that was taught in medical schools many, many years ago. And in medical schools, we are taught ODP, that is the onset of the illness, the duration of the illness, and the progression of the illness. It's taught in medical science. So you sit with the patient and try and find out the exact root cause of your ailment. So that is why I took the initiative today of sharing my talk today. And I want to take you on a journey of another patient that I saw. This is a young girl who saw me a couple of weeks ago in my clinic, and she basically has bronchial asthma, chronic bronchial asthma. I've been taking some inhalers for a bronchial asthma with an upper respiratory infection and allergy. And she has a therapy session with me wherein we try to understand is she allergic to dust and odors, incense or agarbatti in the house, etc. Very important part. Many patients with chronic cough that come to me, I always ask this question, घर में क्या होता है? वो बताओ, घर में क्या होता है? जहाँ पे आप घर में रहते हो, when you are living in the house, what is your house surroundings? Has any physician made it a point to ask, where is your house? What is the house surrounding where you are living? And many times they tell me that either youngsters applying perfumes, applying deodorants, and lining up with a chronic cold problem, or elderly people, of course, using a lot of agarbatti, maybe for a long number of hours, and that smoke can cause a chronic cough. So this patient comes to me, this young girl comes to me, and we go back to her life journey, trying to find out why she's having asthma and why she's having so much of difficulty in breathing. It can be an allergy, but the allergy is linked to your mind, body, spirit axis. And then she mentions that she was very, very obese in childhood, and there was a lot of body shaming that was going on at that time in school, and she was so conscious of her body weight. What she used the word fat shaming, and she was so anxious, and that led to a lot of low self-esteem, and her grades fell down, and then gradually she develops bronchial asthma. And for the past few months, of course, we know it's bronchial asthma. So where do you go? You go to your pulmonologist. Nowadays, patients are so well educated that they will seek a specialist. You go to a pulmonologist and he will give you inhalers and so many things, so many remedies and anti-allergic medication, etc. And so we understand this particular journey wherein this particular segment of her life wherein she is obese and she has put on so much of weight, it has caused her self-esteem to go down, for her to feel embarrassed, and that is affecting her general state of health, which lands up with the asthma, or it can be a throat problem. And so this is what we understood and we analyzed over 1.5 hours. And after understanding this, we give time to our patients wherein I have a moment of silence wherein after a journey, after a consultation like this, it can be quite heavy on the patient, and we always give it some time for the patients to settle down and to come to terms of their entire life. And then she says, yes, Dr. Marolia, I understand what you are trying to say. And we give her a homeopathic remedy, which is significant of her constitution. As you know, all my dear friends, in homeopathy, most of you must have taken homeopathy medicines. We normally give a certain medicine for an acute ailment called as the acute remedy or the target remedy. And then we always help the defensive forces of the human being, of the person, and that is called as the constitutional remedy. Constitution homeopathic medicine, which is selected based on the entire life journey of the patient, finding the cause and the effect. Or the word in Hindi is even better. When you use the word constitution, the better word is prakriti. It's a remedy based on your prakriti, which includes your genetic factors, environmental factors, physical and emotional factors, all in one. So she's given the remedy and she is doing well. So this was another case of trying to understand the root cause analysis in the mind aspect and understanding the entire mind, body, spirit axis. Let us now understand a very, very subtle concept in healing. So when we are well, right? Today, as I speak with you, my dear friends, I feel very happy. First of all, I feel overjoyed. I feel happy to come and share my journey of 34 years in medical practice in my country, India, wherein I'm contributing to the wellness of the population of our Indian people. So, when a person is healthy, you wake up in the morning, आप सुबह उठ जाते हो और आपको अच्छा लगता है, आपने एक अच्छी नींद निकाली है और नींद के बाद आपको रिफ्रेश लगता है. And then you have your cup of coffee or tea and you look forward to the day. आप दिन का इंतजार करते हैं कि भाई आज इस दिन में हम ये करेंगे. And then when I ask how do you feel to the patient, there are three factors that a patient always feels when you are healthy. पहली बात, first thing is a person feels active, right? You are active, you feel a sense of energy. This is a very important concept, and this I teach in the medical university. So the first point, you're talking about health. You feel active. Second, you feel lighter. Am I right? You feel lighter in the body. You want to do this, do that. Third, you feel fresh. Active, lighter, you feel fresh. And fourth is you feel a sense of freedom. You can do anything. You can go to work by train, by taxi, by bus. Feel freedom to do many, many things in your life. So active, you feel light, you feel fresh, you feel a sense of freedom. So what happens when you fall ill? And this is even before the illness starts, my dear friend. I'm going to a segment of your life wherein you are just falling ill. क्या होता है? आपको इनएक्टिव लगता है, आपको डर लगता है, कुछ काम करने का मन नहीं है, सर में दर्द हो रहा है, इनएक्टिव, डर लगता है. सेकंड, आपको भारी लगता है. Am I right? आपको you feel heavy in the body. सर भारी है, शरीर भारी है, feel heavy in the body. Third, you don't feel fresh. And you feel unrestricted. There is no sense of freedom. So these are the three main points which you should know when you are falling sick. And I just remember this, Anu, today in the morning. I said, I must share this particular concept with you because when I talk to my patients और हम जब उनको होम्योपैथिक दवाई देते हैं क्लिनिक में या मेडिकल कॉलेज में, यूनिवर्सिटी में, तब हम पूछते हैं ये कि आपको कैसा लगता है. तो पेशेंट्स कहते हैं कि हाँ डॉक्टर साहब, अभी हमको हल्का लगता है, अभी हमको थोड़ा हल्का लगता है, थोड़ा फ्रेश हो गया हूँ, थोड़ा एक्टिव लगता है. रिपोर्ट्स नहीं देखते हैं, Reports seeing is one part of medical practice, my dear friends. It's your interaction with your doctor that is most important. ये concept मैंने खुद बनाया है और we use that in the university and at my clinics as well of health and illness. Again, coming back to root cause analysis and trying to find out the cause of an illness is we had a patient, a young man who had recurrent ankle sprains. The ankle used to sprain because of weakness of the ligaments. Recurrent sprains once in 6 months, 4-5 months. And he goes to the orthopedic doctor, right? You have a joint bone problem. So you don't go to homeopathic doctor, you go to the orthopedic doctor. Barabar? He goes to the doctor, orthopedic says ankle sprain, ligament tear, grade 1, grade 2, जो भी है. फिजियोथेरेपी, एंकल बाइंडिंग करो, फिजियो करो. 6 महीने बाद फिर से एंकल स्प्रेन. 3 बार ऐसा हो चुका है. And he comes to me. I'm wondering, very active young man having this ankle sprain. Why is he having ankle sprain? And it's so simple. You will be surprised to know what I discovered. And I said, ठीक है, आपके जूते दिखाओ. Show me your shoes. And I see his shoes, and the heel portion of the shoes, the outer portion has been rubbed and eroded. So the heel portion has been at a bad angle. So when he walks with those shoes, the ankle sprains. Orthopedic doctor doesn't have the time to look at your shoes. No. I said, change your shoes, do physiotherapy, keep your ankle in sunlight. Ankle को धूप में रखो, पैर को धूप में रखो, धूप लो, ligament strong हो जाएंगे and you will be all right. It's so very simple, right? And this is the simplicity that I use in my medical practice day in and day out, because medicine basically is a very, very simple science. And many, many years ago, about 14 to 15 years ago, I don't know, maybe more, I was attending a seminar and there was a homeopathic doctor. I was presenting a case and sharing some cases. And there was a doctor from California who came up to me and told me that, thank you, and thank you, sir. You make it look so simple. And then I return home and I open my email, and she sends me the most beautiful quote, which I will always remember for the rest of my life, by Da Vinci. Simplicity is the ultimate sophistication. So very important to understand the way, the simple aspects in medical science and a simple way in life. So I had made a list of many, many cases. In fact, I had another case which I would like to share with you today is a case of a young girl with ulcerative colitis, the stomach disorder, and she approaches me, a thin girl, about 6 to 7 months ago, and she's changed her job and she's gone to a new job, and she's already taking medications for 2 ailments. One is for her acne and one is for her colitis. And she goes to her dermatologist for improving her skin glow. She takes some local treatment for her acne. And she goes to a GI doctor for her colitis. So already she has been compartmentalized. GI doctor gives her all the medications. She's been on the medication for diarrhea and bloody stools for the colitis. She's better in that ailment, but she continues the treatment and she takes her skin complete medication. And I tell her, I said, again, she goes on a life journey with me, trying to understand exactly what is happening in her life. And she tells me that because of the new job, there is a lot of apprehension, a lot of anxiety and nervousness that she is facing in the new job. टेंशन आता है कि भाई ये नया जॉब है, नया काम काज है, कैसे होगा, हाउ डू आई परफॉर्म वेल, how do I try to understand my job better and try to excel in my job and try to excel, and she works long hours, 11 12 hours in a day. And we understand this anxiety and this desire to be so competitive in your work, which is a good thing for a young person. I'm very happy. It's a young person. You have to work hard. And but she said, doctor, by 4 5 in the evening, I feel so sleepy. I feel जो बहुत नींद आती है. And so she's wants to consult another specialist why she's feeling so sleepy. And because she's so working so hard throughout the day, I said, how much water do you drink? And she drinks very less water since the morning. That's just small particular ailment. So we advise her accordingly, because if she has less water, her skin complaint is bound to be worse. So we advise her accordingly, and we understand this particular segment of apprehension and anxiety in homeopathy. It's so beautifully understood, which also includes the symptom of drowsiness. And we give her a homeopathic remedy called gelsemium for an anticipatory anxiety, wherein she's so tense when she gets a new file or a new project in her office, which this anticipatory anxiety is contributing to her bowels, to her ulcerative colitis. So gradually she's under treatment now. She's much better. Her fatigue, her sleepiness is all much better. And gradually we will be continuing with her constitutional homeopathic remedy, and then she should be well. So here again, she understands. So she is empowered by going on this life journey and knowing exactly what she has to do in her life. So this is exactly what I mean, wherein we say that when you are healing a patient, the healing has to be sustained and effective, wherein you empower and make the patient participate in the healing process. That is very important. And that will lead to an improved outcome in the entire healing process. And it's a beautiful process, because you are understanding the entire life journey of a patient. I will tell you another example of another story of a patient, and which will give you a much better idea. Because of our stressful lives today, we are seeing a lot of patients with skin complaints. Am I right? A lot of psoriasis. We see a lot of skin complaints, eczema and psoriasis. And I had a young Maharashtrian lady coming from very far away in a village in Maharashtra in India. And she gives me a call one fine morning that Dr. Marolia, हमको आपसे मिलना है और आज ही मिलना है और बहुत तकलीफ हो रही है. I'm not well and I want to meet you today. So fortunately, I had an appointment slot, and I said, I call her to my clinic, and she has got a condition wherein there are multiple spots on her skin condition, on her body, dark spots on her body, on her chest and abdomen, which is a condition called lichen planus. It's a skin condition wherein the skin is dark in particular areas, and it's very itchy, and it's entirely stress linked. Entirely stress linked. Now she goes to a dermatologist. Dermatologist gives her a battery of ointments, gives her all the ointment that she wants to take in the world, battery of ointments and tablets, vitamins, blood tests, this. And I'm shocked to know that the dermatologist doesn't tell her the basic fact of the nature of the disease, that lichen planus is a stress-linked disease. And she says, the dermatologist tells her, ये तो अभी ऐसा ही रहेगा आपको कई साल तक दवाई करनी पड़ेगी। अब ये तो ऐसा ही रहेगा और थोड़ा कम होगा ज्यादा होगा, और आप बस दवाई लेते रहो। And she had tears in her eyes. 26-year-old lady, she had tears in her eyes. Hey, do I have to live with this ailment? And what if the ailment comes to my face? And it's a basic fact. It doesn't require a very, very high IQ for the dermatologist to understand and tell the young lady that, bhai, this is lichen planus and stress linked. बताया ही नहीं. And she, for our 6 months, she's taking tablets and ointments and this and that. And I tell her, stop everything. Stop everything of your ointments. Take a 7-day break from work. Eat your food well. And this is entirely stress linked. Take homeopathic medicine. Homeopathy can cure lichen planus. Take the homeopathic medicine. And I patted her, said, डरने की कोई बात नहीं है, आप जा सकते हैं. ये reassurance तो भूल गए हैं. Everybody has forgotten the power of reassuring your patient. So very important. Just takes 4 to 5 seconds to reassure your patients. And she was so relieved, so very happy. And then we understood the main reason, the root cause analysis of the skin problem. And that was that she is the eldest amongst 4 siblings, 3 sisters, 1 brother. Brother is married, she is the eldest, and she is running the family. Father had a very, very poor paying job. And so she has an enormous responsibility of the family. And that thought process that she has to earn her money and she has to support her father, mother, sisters, their marriage, their education, this particular responsibility, जो जिम्मेदारी की जो एक फीलिंग होती है, उसको हमने समझा है. That is what we have understood. And we stopped all allopathic medicines completely. Advice about diet, about sleep, about yoga, about pranayam, and she is doing well today. So this is what is happening in the medical world, and that is why we are doing this program today called the Healing World. And there are some other patients that I have been able to help. Lately, we saw a patient of colon cancer who had come to us. Very, very interesting case of advanced colon cancer, operated, and he had consulted us about, I think it's about 3 years now that he's under treatment. And we understood the life journey and his root cause problem, and he is taking homeopathic remedies and mistletoe therapy. And he was on a multiple battery of allopathic drugs. And as he improved gradually with homeopathic treatment, we were able to cut down on all the allopathic drugs gradually. And today he has put on about 5 kilos of weight, living a good life, normal bowel habits. He comes to my clinic, takes his regular mistletoe therapy injections and homeopathic remedies. So it is very, very important to understand the whole human being. I have some more notes over here today, but I want to share one particular case before we end the talk today. I think we have it's about 1 hour and 10 minutes now. So this is a patient that I saw the other day, a 48-year-old lady going through her menopause, having a chronic back issue. And she is doing her physiotherapy and all her exercises and calcium and vitamin D, etc. and she's not feeling better. She's having a persistent back issue, which is affecting her way of life. And we understand what is going on in her mind. So the state of a woman, as we know, when the period starts, menarche, and when the periods end in menopause, menopause can be a difficult time wherein there are certain mood disturbances that can happen, physical disturbances that can happen. So homeopathy understands this menopausal state of the lady. And based on this particular menopausal state, she says that she has become extremely irritable and she weeps very, very easily. And there is a very, very difficult time that she has in understanding and coming to terms with her relationships in the family. And so she was given, and then she has a complaint wherein she's feeling extremely dull. कुछ करने का मन नहीं करता है. She feels extremely dull. And she was given a homeopathic remedy for the menopausal condition called sepia. And with that, all her symptoms, in fact, have settled down. But what is beautiful is what she said after taking the homeopathic remedy. And I want to quote her today. And I always write this down in my diary as patients tell me how they have improved. उनको कैसा लगता है वो भी हम लिख लेते हैं. Even many a times when patients give blessings to us, it's very, very beautiful. जब कोई आके आशीर्वाद देता है, because God bless you. And I go home and I write it down in my diary. And she says, after 1 week of treatment, and I quote, can take things better in a better way and feel more balanced. So you are able to bring about a general change in the lifestyle of a patient. जो हर मरीज महसूस करता है वो भी आप चेंज कर सकते हैं. So these are the few cases and this is the few subjects today in the Healing World program that I wanted to share. And I think I have come to the end of my presentation. If there are any questions, I leave the space open. Anu, you can give a small summary and then we leave the space open for questions.
Thank you so much, Dr. Zubin, for giving us this enriching talk on holistic medicine. I'm sure everyone would resonate with this. And if anyone has questions, please feel forward. Please feel free to ask. We'll take them now for about 10-15 minutes. You can type in the chat box or
state of questions or maybe
Zubin,
yeah.
Dr. Supraja has asked a question. In
Yes.
fact, I just gave your link yesterday and I'm on a trust with her. Please answer her question. She has raised a very important question because she is doing a lot of work in the pulmonary, she's a pulmonologist. She's doing a lot of
Yes.
research and doing detailed exercise on conducting even gene studies on pulmonology. She is very curious to know. She is using yoga, Ayurveda, and other things. How can she use homeopathy in this? She wants to know. Please ask her, answer the question.
Sure, definitely. So I think
DS is the initial that she has got, Dr. Supraja.
Yeah. 1 minute. Yeah, okay. So I think at this juncture, I read the question. So in sleep apnea and a respiratory pathology, so basically a respiratory pathology is when you breathe oxygen, how you are breathing. I think it's very, very important to understand how a patient is breathing normally in the daytime. Is it a shallow breath? Is it a deep breath? And sleep apnea is also another question that I got. So you have to understand the level of breathing. And the level of breathing can be affected by many, many medical conditions as well as stress and chronic anxiety. Chronic anxiety is linked with shallow breaths. So I think pranayam is a must at this juncture for respiratory ailments patients. A deep breath pranayam in the open air, most important, in the open air. If many times we see people going to the gym in a closed atmosphere, in an air-conditioned gym, doing yoga, it's better that you do pranayam. Of course, there are practical difficulties, I agree, but you need to do that in an open air. So pranayam, yoga, and trying to understand what aspect of chronic anxiety is causing the respiratory condition which is affecting the breath.
I can't agree more with you, sir. So, yeah, I'm Dr. Supraja, and as Dr. Shandilia put in, we started this integrated practice a couple of years back, and last year we were able to put in around 50 people into. The whole concept is to reduce allopathic medication, integrated with other things, so that they get in the benefits of all the other specialties. So, 50 people we were able to put through physiotherapy, yoga, naturopathy, diet, psychological counseling. That is where I feel a huge amount of turnarounds and game changers started happening. So at least those 50 patients who are my regular patients who get admitted every year, and the number of admissions which are going up every year, started breaking the cycle. And last 1.5 years, they've not got admitted. They're having a good quality of life. Like as you said, the measures of quality. I'm happy actually. I'm in the right direction. Sleep, diet, exercise, and activity and vitality. These are the questions which I ask them how they get feeling better. We are getting a lot of youngsters for females in 40s who are coming with especially these joint problems. We call them as connective tissue disorders. Along with that, the lung is also getting affected. So a lot of psychological component is being the reason why the stress is the reason why they're developing these diseases. So I appreciate, I'm happy I attended this session, and at least I'm an early physician in the career, so I'm at least going in the right direction. So
Thank you
I
so much.
wanted to know,
I
when
wish
do
you
I
well.
add? Mr. Sandilia was informing of homeopathy last couple of weeks that we have been talking to him. So I wanted to know, when do I add in homeo, or when do I choose whom to liaise with? That's the question which I wanted to know. When do I choose Ayurveda or for a respiratory physician?
Okay, right. That's a very now see integrative medicine. There are so many modalities, Dr. Supriya. There is of course in India the two primary complementary therapy modalities are Ayurveda and homeopathy. Okay, so ultimately I think it is the calling of the patient, what the patient wants. I think I have a tremendous respect for both these streams of medicine because both look at a patient at a holistic level. Even in Ayurveda, you try to identify Vata, Kapha, and Pitta. So you both these streams of medicine look at a patient at a holistic level. So whatever the patient wishes or to take, I think you can use the assistance of your colleagues in the field of Ayurveda or homeopathy. I'm there to help. I'm just forwarding you my email address, and my phone numbers are there with Sandelia as well. And you are most free to connect with me, and I'll be most glad to help.
Sure, sir. Sure. Thank you. Thank you so much.
Yeah.
Zubin, Dr. Supraja, in fact, last about a year and a half, she has got a tremendous experience in this field, having worked in Apollo and a couple of hospitals. But now she is with Medway Hospital, and she has started a research institute there.
Okay.
And started a trust. Yesterday was the first trust meeting, and I'm one of the trustees in her trust. So that's how I started telling her about homeopathy. She was very keen to know. So today, because I guess she was attending the session also, I'm very happy that she was there in the session, asked you some questions. But I think it is important for her to also know as to when and how it can be used. I mean, homeopathy is not the only solution. And as you and I have discussed many times, that there are other aspects as well. But when to use homeopathy and what kind of time it can be done, what are the usual factors? I think that's something which I'm sure she'll get in touch with you to learn more about the system. And I will also spend my time with her to tell her as to how we look at a patient in totality. I mean, I also have something like 40, 50 years of experience in being a hobby homeopath. I can always give her some insights into the system as to why the system works and what happens. She was very concerned yesterday, asked me a question. There are a lot of metals used in homeopathy. Would that have any implication? I said, we have animal kingdom, we have a mineral kingdom, we have got vegetable kingdom. All are important, but then we use depending on the patient's condition. I just left it at that. Maybe later on she'll get to know more about this where I'll spend some more time with her. Thank you.
Definitely. Thank you, Mr. Sandelia. I have known Mr. Sandelia and his unending faith and passion for homeopathy for the last 25 years. We are friends for 25 years, and we have connected on various fronts of reaching out to people and healing people. And thank you for joining in. Are there any other questions? Anu, would you like to
Yeah,
ask
I
me
see
anything?
I see a few questions on the chat box. If you can
Yeah,
take it.
sure. I think one question is by Yamuna Balagopalan, having a problem breathing. I think it's important that you do a cardiorespiratory analysis. I'll just, maybe it's important to understand that you must know exactly what a cardiorespiratory evaluation is required to be done, as Yamuna has mentioned, and then you have to identify what is the reason why there is a breathing problem, and then you take it forward. It will be difficult for me to pinpoint and give an answer to a very general health-based question. For periodontal disease, I mentioned a remedy in homeopathy called Plantego, which we use. Now, for this question of Pratima asked a question, recommendation for disc problems C3, C4, and C4, C5. So prolapse intervertebral disc is entirely curable with homeopathy and physiotherapy, which is a particular therapy modality that you use, which is called as the Mackenzie's maneuver. I think you should tell your physiotherapist to teach you what is called as the Mackenzie maneuver, and that will help you to completely cure a disc. Normally, in an MRI scan, you will always see C3, C4 disc bulges. Nothing to worry about. If you are not having any symptoms, nothing to worry about. Do your regular physiotherapy exercises. Okay. And then there is a question, one new message. Can we initiate a consultation with you? So I'll forward you my telephone number is 98063575. You can give me a call and take an appointment. And there is one more message. Detailed mental symptoms. The story. I think I can answer this. The story of the patient will give you the mental symptoms. So you normally, many of the students have a difficulty in understanding the mental symptoms. So we always tell them the patient should narrate their story. Then telephone number. Of course, my contact details are with Anu and Sivapriya Suresh. And any recommendations for healing periodontal disease? This could be a deficiency. Sometimes a deficiency can cause periodontal disease. So there is another message. One second. Any recommendations? And then Pratima, it was excellent, very informative. Thank you for all your kind words. Anu, would you like to add anything or?
No, doctor, I have a question here. I have a question here, doctor. This is Prakash. Namaste, Acharya ji. Namaste, doctor. So I have a couple of questions and I have experience to share. So my first question is, you talked about few cancer patients, right? And you also talked about stage 4 cancer treatment. So did homeopathy completely cure that? I'm curious to know that. Because one thing I want to know is allopathy treats like removing the tumor and doing chemotherapy. How does homeopathy handles that? How does it really treat at a lower level? How does it get rid of those cancerous cells?
Uh, so basically, cancer is a very complex disease. And today we are seeing a spate of incidents in cancer patients around the world. So every cancer patient is different. So when you see a stage 4 cancer patient, you have to understand what is the general condition of the cancer patient. So if the metastasis is affecting a vital organ like liver, bone, lungs, then the cancer is controlled and can be put under control with homeopathic medicine and mistletoe therapy. So if you, I'll just add to my chat also, and this is basically on mistletoe therapy, which is a plant-based therapy from Europe, which I specialize in. So, and it helps the immune system. So if you are taking regular mistletoe therapy, then the cancer can be controlled, and also the metastasis can be controlled. But many a time in stage 4 patients, when they come to us, they are already taken lot of chemotherapy and radiation and other strong allopathic drugs, and their immune system has been destroyed, has been suppressed. And in that sense, we are not able to revive the immune system. So in many patients, it is a palliative care approach. But in some of the patients, we can prolong survival as well as and control the disease. So cure in stage 3 and stage 4 is a very difficult thing to happen or to aim for. So we usually see what is the condition of the patient and then plan the treatment, whether it is to control the cancer, to bring the patient in remission, or to do palliative care, just to help the patient live a peaceful life. I think there is any other question now? I think yeah.
Doctor, I have one more question here.
Yes,
Uh,
yes.
So today the sugar and diabetes is a huge problem in the society, right? So how
Yes.
does homeopathy has a good remedy?
Diabetes entirely stress linked, sir. Diabetes is entirely stress linked. And one second, now just give me a moment. And it's how you eat your food. Basically, diabetes is how you eat your food. All your life and lack of activity and excessive sugar. So you have to make an entire lifestyle change for a diabetic patient to be better. So you really have to understand their entire life journey. And sometimes it is difficult because they are on insulin, they are on oral hypoglycemic agents. But many a times we have been able to help diabetic patients as well bring their blood sugar down. And yoga is a very, very important part to treat diabetic patients.
Thank you, doctor. So now I have one experience to share here. I know all these treatment modalities, they treat the patients at the body level. But I have been joined, like I have been doing this exercises and pranayam, and Acharya has given us Nadi Shodhan practice. So Nadi Shodhan is the subtle nadis which are operating at the in the like a subtle body level. So that has given me tremendous benefits. My a lot of diseases how disappeared, gone. So does homeopathy also work at that level?
What did you do, Nari Shodhan? Can you
Nadi
explain to us
Shodhan,
what?
it's a cleansing of nadis. So right, so we
I'd
have
love.
like
I would.
it's a exercise similar to Anulom Vilom, but it's you hold the breath between two breaths.
So I would love to. I would love to know more about this. What is your good name, sir?
Prakash Dage.
Prakash, I would love to know more about it, how you have helped yourself.
Yeah.
You can write me an email, or you have my number. I have mentioned
Yes.
my number in the chat
Yeah.
box.
Yeah.
I think for all of you all, and I would love to know what you've done, because you always keep on learning new things.
Yes.
So if I'm able to learn something from you, I think it will be excellent.
I bow down to Acharya here, who is he's attending this session. He has taught this practice to us, basically.
So
Acharya.
thank you very
Yeah.
much. Thank
Yeah.
you so much. Okay, Anu. So I think uh, we end today's talk, and would you like to say something?
Yes, thank you so much. Thank you so much for your time. And we will share your contact card with everyone so they can reach out to you. And now I request Acharya to speak a few words and thank the esteemed speaker. Acharya, please.
You're on mute. You're on mute, Acharya ji. You're on mute.
We are not able to hear Acharya. Something. No.
Is it any better now? No?
Yes, yes.
Okay. Thank you. Thank you, Dr. Marolia, for your great session. It was definitely quite informative, and I'm sure your comprehensive approach, which is kind of integrative medicine, which you are practicing, must have helped many by in your journey so far, and you're definitely on a long haul, I'm sure. Uh, One thing which I found interesting when Anu discussed uh, her meeting with you and your interest, I saw that yes, homeopathy is something which I personally know as a medicine-less medicine that I have been introducing to my students. That yeah, it's a medicine, higher the power, lesser the medicine. You see, this is the beauty of this particular therapy. We say higher power in allopathy, we say more medicine needs to be injected. So kind of it's an energy medicine which works on different symptoms and systems well within our energies. And many books that I refer to on homeopathy, they kind of also talk about the lunar cycle and how lunar cycle impacts a particular disease and impact, and it is very close to the system of tantra. And we also acknowledge, in fact, our Sanatana is quite linked to following certain festivals, certain rituals, certain kriyas which are to be done on certain particular dates. So yeah, going by that, I can see quite a correlation here. And sometimes people do ask, uh, was homeopathy invented by someone by hit and trial? Then my answer to that is it's a master's work. Somebody who could probably invent like this must have been in a way enlightened person, because it's not possible for a person to practically research each and every medicine and then list out all the symptoms and medicines which can work for it, work against it, and according to lunar cycle, etc. It's just not possible. So basically I see this therapy as a outcome or evolution of the medicinal system that existed at that time. And since then, it has evolved. I'm sure people like you will take this particular therapy to greater heights, because you are not only, as Dr. Shandilya also said, I'm using word doctor because he's a he's a non he's a doctor by action. We say karmana brahman, that like Dr. Shandilya is also saying that we believe that all therapies are equal. We do not simply say that this particular therapy will heal everything. So this is definitely a very good approach. Otherwise, I feel there is a lot of fight going on between and Ayurveda and homeopath. And it's very recent development, which I find very interesting and very helpful for each one of us, because now we can take benefit from all the therapies and all the systems that exist. And finally, I found it very, very important from your talks, what I gathered, that the time that you give to your patient, it's very important, because in our Shastras also, it is said that there are three positions where you should not lie. Three positions. One is called Sachiva, which is secretary, Vaidya, which is your doctor, and, and Guru, your teacher. Three places you should tell your story wholeheartedly without any blinds on. And the more patient become open with a therapist, I'm sure you would also know that more you are able to help them. And effectively, the quote which I'm using here is from Ramayana, where it is written, Sachiv Vaid Guru Teen Jo Priya Bolahi Bhaya As Raj Dharma Tan Teen Kar Ohi Begihi Nas. I'll just translate it for you. Sachiv means personal secretary or advisor. Vaid means the person who is treating you. And Guru, the one who is giving you wisdom. If they start speaking untruth because of some greed or because of some fear, then they cannot do their job. This is the thing. But what I see today in normal scenarios, it is not priya bolahi. It is they do not speak at all. As you said, no doctor is ready to give time to their patients. Forget about telling the truth or untruth. So I'm sure those uh, therapists and doctors like you who give time to their patients, they definitely can do miracles as you're doing, Dr. Marolia. And I wish you all the best. And we would definitely look forward to meeting you again on some other topic, maybe some other researches. And thank you so much for your talk. Thank you.
Thank you, Acharya ji. Thank you, Anu, for inviting me over. I wish you all a very pleasant evening, and I wish you well. God bless.
Thank you.
Thank you. We'll quickly.
Thank you. Thank you, Anu.
Shivoham. We'll quickly do a
Sure.
concluding prayer for everyone. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschit dukhabhagu, sarve jana sukhina bhavantu. Thank you, everyone. I bow down to the divinity in you. Shivo.
Shivoham, Shivoham, Shivoham.